Your time right now is 7:16 and you're tuned in to the Coffee Hour here on Radio Sri Lanka. As we look forward to a day full of good health and wellness, we have a special guest here with us today, ready to shed some light on the fascinating world of personalized medicine within traditional medicine and Ayurveda, as well as some terms that we might not be familiar with. We have Dr. Pushpa Kulantha, who is a senior lecturer at Faculty of Indigenous Medicine, University of Colombo, who is also the former head and a researcher in the field of Ayurvedic medicine. Welcome, Dr. Pushpa. Let's kick off with introducing our listeners to this traditional medicine and highlighting some key features of traditional medicine and Ayurveda.
Yeah, first of all, I want to say thank you for inviting me for this program. Okay, then you first ask the question is what are the key features of traditional medicine, right? Yeah, then we can see in traditional medicine there is a holistic focus. And that is actually considering physical, emotional and environmental factors of a person that contribute to health and their diseases. Okay, then it is this approach naturally leads to some level of personalization. You can understand. And the second key feature is tailored treatment. That is for the personal unique characteristics, understanding that personal unique characteristics and like age, gender and the constitution when determine treatments. Okay, then accordingly practitioner can arrange and instruct the person or the patient for the remedies, dietary adjustments and lifestyle modification. That is the second one, and accordingly modification might be personalized. Actually it is the personalized based approach, just it is not broadly discussed among the community. And the third key feature is experience based knowledge, which is traditional medicine always has that. Practitioners often they extensive knowledge passed down through their lineage, through the traditions, through actually as well as not only that personal approach, but it has a scriptural based. So those scriptures, it is actually it is 5,000 before years.
5,000.
Yeah, it is scripture. Then those are using for their lineage. Traditional practitioner lineage and come up to this level for that knowledge. Actually, it is not only in the patient need but symptoms and diagnosis. That is, it addresses the patient, how the patient react with this society environment as well as the other community as well as the disease wise and response to treatment, how those factors respond to treatment like that assess. Those are the main three key features of the traditional medicine and Ayurveda.
So Dr. Pushpa, now this personalized medicine, now we see that even within Western medicine, is it that Ayurveda has borrowed this from Western medicine, or has it been around for a long time within Ayurveda?
Yeah, it's a very good question, interesting. And that I just explained about key features of Ayurveda. So personal medicine that discussion has come very recent to society and the community. That personalized approach is much think about that genotype examination. That is the basic of the personalized medicine in modern medicine. But that overall approach we are thinking a patient or a person as a unique. Then we have to think about his practices and thought process and like that. That is more personalized. That means that genomic examination is very expensive. So it is very expensive. Whatever the knowledge can use, what available knowledge to diagnose a person as a whole as well as unique person. Person is unique. Then, but when we go through the holistic approach, only we can find the unique person. So that is the personalized approach in medicine tradition and Ayurveda. It is very cheap and very economical, but then the genome expression, genomic understanding, sequencing very expensive. That is the theme behind modern medicine in personalized approach.
So, Dr. Pushpa, now you mentioned that it's much cheaper compared to the approach in Western medicine. So, can you shed some light on the approach? What is the protocol within this traditional medicine and Ayurveda that you take when it comes to this personalized medicine?
Yeah. Think like this. If you have wise, no, actually, it's skillful. Skilled warrior, okay, and as well as you have strategic wise strategist. So skill warrior can approach directly to the treat the patient, come back to the microorganisms and like that. But the strategic wise, that he is the key role play a key role to balance inside the situation with where it is fight with the microorganisms, and actually it is a holistic balance, and they understand what is the approach to cure the situation. It is a strategic plan and understanding his personality and the lifestyle and habits. So accordingly, adjustments can bring up to the normalization situation. There is whole world. It is a big approach. It is a big picture, and as well as rather than attacking directly to the microorganism. Okay.
So
that it comes under that concept comes under discussed under symbiohealth. It is a new term coined in this recently in the scientific world. That means that both they work together. That wise strategist as well as the skilled warrior. So if those two can combine together, that will be a very good successful story. We can write a successful story behind us. This is patient curing and to maintain personalized health as well as personal health and the community health even. Okay.
So the holistic approach is the pinnacle of this personalized medicine.
Yes.
If you take, you mentioned a new term, symbiohealth. I think this term is new to our listeners. It is new to me. Can you give a quick definition of this, introducing what this term is? What is symbiohealth?
Yes. That is that, the traditional medicine practice can, usually they do pulse examination and other 10 aspects examination. So there are 10 aspects to examine usually to understand the person's situation. That is traditional medicine, Chinese medicine, usually traditional Sri Lankan medicine, they do practice in that pulse examination. And Ayurveda, they do checking that all the three biohumors, that is three dosha. And traditional Chinese medicine, they check their yin yang energy and Q energy like that. Those things are three different situations in the traditional sector. If we can combine those aspects to diagnostic purpose, that is very easy for the person who is approaching their medical treatment. Then it is not much costly, because nothing to bear but the cost. So the patient or the person has a benefit of that side for diagnostic approach, because the diagnostic approach is very expensive in these days. And as well as some kind of combination can be done for the treatment practice also. Especially the lifestyle changes and lifestyle modification, as well as some kind of habit changes, as well as sleep and like that, everything can be adjusted if to get a better result of any kind of medicine, whether it is modern or whether it is traditional. So in that way, if we go through the diagnostic approach in this way, medicinal traditional aspect, as well as lifestyle adjustment and kind of surroundings can arrange with the traditional knowledge and giving treatment according to the modern medicine, modern aspect, that combination works well, because for the betterment of the health of the person. That practice are done in India, because that they have enough knowledge in both sides. So those they created this they coined this term, and now they are practicing that, because they get enough facilities for practicing and researching this side even. So then that way they get betterment for the patients and the society.
Okay, thank you, Dr. Pushpa. We'll continue the discussion after this short musical break.
You're with Radio Sri Lanka on 97.4 and 97.6 FM.
Thank you for always tuning in. Here's another one of your favorite tunes. Stay stuck.
Siddhalepa Asamodakam. No artificial colors, flavors, preservatives or alcohol.
From where can we buy?
From all outlets, pharmacies, boutiques and supermarkets. Siddhalepa Asamodakam.
We are continuing our discussion with Dr. Pushpa Kulantha about the practices within traditional medicine. And when we had a call on this matter, Dr. Pushpa, yesterday, you mentioned that it's like a detective story. We all like a detective story. First of all, can you elaborate a bit on that? And then we'll also discuss about the terms we have epigenetics and phenotype, genotype. We hear these terms a lot within Western medicine. Is there an equivalent within traditional medicine? Can you elaborate on this?
Thank you for asking this detective story. How to write a detective story with checking the personal health. So then, just like a detective gathers clues to solve a case, traditional medicine use holistic assessment to understand your health. And this goes beyond just your current symptoms. They look at your past, like your lifestyle habits and family history, your present health concerns, and even consider your future susceptibility of certain diseases. Okay, and think of as a big picture approach according to traditional and Ayurveda and other Asian traditional system of medicine by looking at your behavior, thought process, food choices, and daily habits. They can predict your risk of developing certain mental and physical illnesses. Okay. This information is then used to create a personalized plan for prevention and healthy living. Okay. Then it's like getting clues on how to stay healthy and avoid problems down the road. Okay, then down the road. Then there are some key things traditional medicine might focus on. Diet. First, diet. What you eat can have a big impact on your health. And the second is lifestyle. Getting enough sleep, managing stress levels, and regular exercise are all important for the lifestyle management. Habit, as well as habit, that's everybody is addicted with the smoking and other alcohol and all the things, and lack of physical activity is a kind of addiction. And now it is very seriously addicted thing is that what is it, screen addiction. It's a new addiction, new method of addiction. Actually, it's very harmful for the health, and it changed the healthy lifestyle. Even people looking at the screen for 24 hours. Nobody, just go auto sleep and they start again to the peep into the screen, and that's a very bad habit recently developed by especially on the young community. And by understanding your unique pattern of behavior and health, traditional medicine can empower you to take charge of your well-being. Okay, then it is protective approach to keeping you healthy as well as and preventing future problems. And that way, traditional medicine believes that lifestyle choices can influence your body balance. That is called, special term, Tridosha. It is in Ayurveda. It is specific, unique to the Ayurveda, not any other kind of medicine. In this Asia, traditional medicine in Asia, and everyone has a unique combination of these three main doshas. That is Vata, Pitta, Kapha, we call it. You may heard it from ancestors. And imagine those doshas are energies. This actually kind of energies which works on the human body, overall your well-being. And by understanding your body type, that is, you asked me about the traditional system of understanding the personality. That is the terms used in Western medicine, I think the phenotype, genotype. That phenotypes comes first. If I look at your side, I can understand your phenotype, but I can't understand your genotype. It is within the cellular level. I can't understand. So that there is traditional medicine that also can understand to a certain extent, not reading by gene sequence. sequencing, but we can understand it is genotype is there and phenotype is there, as well as those two overcome by the epigenetics. That epigenetics, you actually, it is very nice to mention here. Epigenetics is the way that genetic expressions concealed in some other way by changing your addiction as well as lifestyle. If you practice a good lifestyle, means that with ethics, following ethics and all the kind of good things, you can, especially that some recently started, and even the USA they start meditation for the curing cancer. So that cancer, reversing cancer, spreading cancer can be done through the meditation. There's a kind of lifestyle changing that goes through the epigenetics. That talk about that using the epigenetics. Epigenetics can conceal the gene expression of cancer. So then it comes as a phenotype. Then we can see a patient like suffering from cancer. So that is the phenotype of the patient. But the healthy, that phenotype is different. He's healthy. He has a kind of prominence of those three energies. Vata, Pitta, Kapha. Maybe person appearance lean, thin body, skinny, like that. This kind of some kind of special bioenergy. And if a fatty boy, it's a fatty person. It's kind of bioenergy called Pitta. It comes actually it is because of has a power of cohesion, high power of cohesion of that such people. As well as that, other than always getting hungry and getting vulnerable to the disease like gastritis and migraine, those comes under that kind of special energy called Pitta. So those three comes together. When it comes together proper way, that balance the health. So that is the way we understand phenotype. But genotype you can understand according to Ayurveda, that is actually body frame. If it is a thin, lean body frame, that is coming to a separate category, and that according to we can categorize population also. So then in that way we can develop a kind of medicine fixed size for all, means kind of fit for all. That's like Panadol use. Okay, so and we can use Panadol without harm, but we can develop kind of that drug. But thing is that when we come to the population, kind of such special population with such kind of bioenergy, or Vata, Pitta, or Kapha, then we can take the person from that population and cater a special unique treatment for the person because of the personalized medication, personalized type of medical approach, because in this Ayurveda traditional medicine. So in that way we cover epigenetics, genetics, as well as RNA phenotype. So in that way we can understand, we have all kind of approach since from the 5,000 years before. So it is nice to understand anybody that is there. But main thing is that if you go through your health, if you understand your health and who you are, to understand that you have to think about your bioenergy, how it works. So kind of understand is needed. What is your bioenergy level? So accordingly you can adjust your lifestyle, and accordingly you can have your habits, and accordingly you can select your food and everything, and sleep even. How much sleep you want. If you have fatty boy, you would have less sleep. Is good for reduction of your fat level. It is there. And exercises is some other way to get reduce. That we know everything, then we can understand what is the fat level, and we can calculate the level of exercises you need, a level of sleep. We can calculate accordingly. That can come to a compromisation of your bioenergy level. Accordingly, then you can become a healthy person, and added with that you can have good lifestyle and good habits. So then again it comes to the reverse back to your normal healthy life.
Okay, so ultimately it comes back to the holistic approach, our lifestyle choices, how they reflect daily habits,
behavior and thoughts.
Those reflect on our health, and even screen addiction, smoking, all of these are ultimately affecting our health, like you highlighted. And also you highlighted that this genotype, phenotype, although we have these terms coming out of Western medicine, these practices have been there for thousands of years in Ayurvedic medicine. So let's take another short musical break and continue our productive conversation.
Your kind of music. all day, all night, right here on your one and only station.
You're with Radio Sri Lanka on 97.4 and 97.6 FM.
In order for you to invoke blessings upon your family and the nation at large, with the sponsoring of the delivery of the sermon by the Mahasangha on the airwaves of National Radio, get in touch with us to be a part of this meritorious deed by calling us on 0112 696 271 on weekdays between 9 and 3. The meritorious contribution for the Dharma exceeds all other meritorious deeds. Be a part of this meritorious contribution.
You're with Radio Sri Lanka on 97.4 and 97.6 FM.
Continuing our discussion on Ayurvedic medicine and traditional medicine here on the Coffee Hour, I have one more question for you, Dr. Pushpa. You mentioned that mindfulness or rather meditation is being used even in the US for cancer patients. So what is said within this Ayurvedic practice about this meditation and mindfulness?
Yeah. Thank you for asking this kind of question, because nobody is concerned about this area. Okay, then it is practiced in America largely. Sri Lankan people, it is there, but nobody has understanding about how to practice meditation for the betterment of their own health and curing diseases. Mindfulness is the one which we have to think about where we are at the moment, and momently think about myself and connecting with me. That is the one we can simply say mindfulness. It means that where am I, who am I, like that. Always, if I think, that is kind of mindfulness. But if you can concentrate in a bit, if you get just relax for 1 minute, you can have a kind of respiration. Think about respiration way, just not forcefully, but you have to think. If you can think about my respiration level, if it is good or not, and how length it goes and how short it goes, like that. If you can, there's a momentary thinking that improves your level of mental functions. 3 kind of mental functions that works very well. So in that situation, according to our tradition, we know that bioenergies get subsided. It doesn't work fast. That it comes to a kind of settlement, not vitiated level, it can balance level because of this mindfulness. Think about myself, think about leisure, become leisure, relaxed person. Stress level, it goes down to stress levels. High stress become normal. When it is coming to the normal stress levels, that bioenergy works well. So it is the basic behind our traditional medicine, and Ayurveda is very popular in Sri Lanka anciently, but here it is nobody's awareness. But if it actually proposed for the school syllabus, now I think it has introduced for the school syllabus with mindfulness and how to manage your stress levels. Like the students are teaching in kind of some schools. I know, and actually that is the best message we can give for the people today, listeners today. If you can search more, if you can find more information about mindfulness, many workshops are there, and YouTube also some kind of mindfulness practices are explaining. And actually people come here from Western world to understand what is mindfulness, because it is cost effective. There it is very they have to charge more, but Sri Lanka it gives free. So in that way, yeah, it is a major difference in Sri Lanka and other Western countries. Best thing we sell free, but without taking any money, any cost effective we treat. Actually, Ayurveda also is a kind of actually cost effective and betterment for the patients as well as for the society, and as well as it actually usually traditional doctors treat free. Now it has become a very serious situation, but even though they don't have that kind of mind to earn money through curing patients, that is a kind of metta mudita karuna, like that. It's a mindfulness. That's a kind of, you simply say mindfulness, where am I? I have to think about where am I, who am I, what am I doing at the moment, and what's the level of my stress, as well as what is my respiratory level, where is it? It is a long respiration, short breath, long breath, like that. It is a starting point of a mindful practice. Okay, then there are some other steps to go beyond. So people who are interested with mindfulness can approach at that level even.
Okay, Dr. Pushpa, so like you mentioned, even a minute, if we focus on what we are doing, where we are, who we are, that can have so much benefit for our health and of course the stress level. So that will balance the energies within our body according to Ayurveda.
Yes, of course. You understood it.
What other message do you have, like in addition to focusing on mindfulness, what other messages do you have for our listeners? And also I'd like to ask about any courses, any other resources that are at the disposal to learn further about these topics.
Yeah, we have started at the planning level and make people aware about the traditional medicine as well as the mindfulness. And actually it is a human awareness, society awareness courses are there we are planning, but we can show in our website when we are going to start, like that. That is our faculty. It's our faculty. Okay. Then as well as what is the key information we are going to have convey today for the listeners. There's a takeaway message. Traditional medicine, emphasizes the connection between your lifestyle and your health. So then traditional medicine has a connection, it connects your lifestyle and as well as health. So that always it emphasizes what is the health, what is your, who are you, what is your health situation, as well as what your connection between the environment. That also there. So how you interact with the environment. So if you have good kind of environmental relationship, you may balance yourself with your health, and you will get good balance of your three bioforces. And secondly, by understanding your body type, that is Tridosha, we said, you can learn how your daily choices might affect your well-being. Okay, and that is already just we explained, but in future we are going to explain everything, like how to balance their lifestyle and the stress level, how to get a good sleep, like the things we are going to explain through our courses. So we offer a few courses recently. We are going to offer a few courses recently. Other thing is making adjustment to your behavior, diet and habits can help maintain a healthy balance and potentially prevent future problems. Those the key information I have to give for the listeners for their future and for their future health protection and prevention and promotion. So even if a listener have a kind of diseases, accordingly he can start to think about who is he, who am I, who is like that, and start meditation practices, and then they will get kind of balance. And that epigenetic, it is the epigenetics we explained and the modern medicine, and epigenetics can cover many roles to get person to a normal situation, to a normal healthy person. It is actually everything collects under epigenetics. That is ethical behavior and meditation and good thinking pattern and good life habits, sleeping habits, food habits, like that. Those comes under epigenetics. So it has already explained, but term has come really recently to the society.
Thank you so much for sharing this knowledge with us. Today we had Dr. Pushpa Kulantha, who is a senior lecturer at Faculty of Indigenous Medicine, University of Colombo, who was also the former head of the section, as well as a researcher within the realm of Ayurvedic medicine. And today we discussed about Symbio Health and practices within traditional medicine and Ayurveda, as well as personalized medicine. So I hope all our listeners gathered some invaluable knowledge, and if you are further interested about further learning about this, you can find so much resources online as well, like Dr. Pushpa mentioned. Thank you, Dr. Pushpa, once again for being with us, taking a moment of your time to share this knowledge.
Thank you very much, Anupam, and your team for inviting me for this kind of discussion.
Thank you so much.